这个会是人有一些啊，这个 Zoom 里面不多，但是它直播的话，它会有一个 OK 英文啊，是对，so it's about time.
Yeah, okay. It's okay. Yeah.
So I think we should get started. Good afternoon, friends from home and abroad. Welcome to our second online seminar hosted by extracellular vesicles and circulating nucleic acids. I'm the associate editor of this journal, Wei Liangxia from Shanghai Jiao Tong University. And today I'm the host, and also we have a guest, Professor Dang Yang from Shenzhen University. Today's seminar will be given by Professor Pingping Han from University of Queensland. Before Dr. Han gives his talk, I'd like to have some introduction of the journal and also of today's topic. So I'd like to share the screen. Uh, can you see all right, can you see the screen? All right. So I hope everybody can see this is today's topic. It's potential applications of periodontal cells-derived extracellular vesicles given by Dr. Han. And so let me first briefly introduce our journal, Extracellular Vesicles and Circulating Nucleic Acids. It is actually founded by our editor-in-chief, Dr. Pen Lo from NIH, and she is a senior investigator at NIH. And our journal actually has been recently been indexed by ESCI, and then previously has been indexed by a number of databases like Scopus and also other platforms. And it's expected that next year our journal will have its first impact factor. So for this journal, actually, we have a number of special issues alongside with our regular publications. For example, one of the special issues is co-edited by Nobel laureate Randy Schekman together with Dr. Pen Lo. And we actually have plans to actually launch a series of other topics and to promote this journal. And actually today's seminar series it's a joint effort to promote our journal and to make this journal a good platform for researchers from the globe to discuss, to communicate the research progress in EVs and also circulating nucleic acids. So I'm Wei Liangxiang from Shanghai Jiao Tong University. I'm a tenured professor and at the School of Biomedical Engineering. So I'm not going to introduce myself too much. So actually today's keynote speaker is Dr. Pingping Han. She is from School of Dentistry, University of Queensland, and she is a senior lecturer. Dr. Han is a group leader of epigenetic nanodiagnostics and therapeutics groups within the Center of Orofacial Regeneration, Reconstruction, and Rehabilitation, Core 3 at School of Dentistry, University of Queensland in Australia. And Dr. Hans was recently awarded a prestigious National Health and Medical Research Council Investigator Fellowship. Her current research focuses on two themes, and first is salivary diagnostics for periodontal disease, and the second is the extracellular vesicles as a cell-free regenerative medicine for periodontal tissue re-engineering, tissue engineering. And she is a mid-career researcher. She's very young, as you can see, but she has published over 70 papers already, such as ACS Nano, Biomaterials, etc., with an H index of 31. So today, actually, we also have a guest to facilitate today's seminar, and Dr. Zhang Yang from Shenzhen University. Let me also briefly introduce Dr. Yang Zhang as well. Dr. Zhang obtained his PhD degree from School of Dentistry. Redbound University Medical Center and continued his research as postdoc in the same university, actually, in the Netherlands. After that, he joined Central University as an AP and principal investigator of the Term Lab. And his research is mainly engaged in regenerative dentistry, osteoimmunology, and extracellular vesicles. In the past 5 years, he has more than 40 publications in the field of tissue engineering and regenerative medicine, such as biomaterials, stem cell research, and therapy, and etc., with an H index of 24. He served as the young editorial board member of our journal and also as a peer reviewer for a number of journals, including biomaterials, etc. So, without further ado, let's welcome Dr. Han to give her a lecture. Dr. Han, please. I will stop sharing the screen. All right. So I think, Dr. Han, it's in the so probably you have a second screen. Yeah, this remote. Oh, that's good. Okay.
Okay, great. Thank you for Professor Xia and EVCNA for this chance, and thanks for the great introduction. Today is my honor to talk about my research in front of so many other potential EVA researchers. And today I'm going to talk about mainly periodontal cell-derived EVAs. That's my topic, but additionally, I will talk about something relevant to the research I'm doing. So, as introduced by Professor Shah, I'm a senior lecturer and a group lead in Call 3 Center within School of Dentistry and in University of Queensland. So, before we start about the real science, I would like to introduce a little bit about Brisbane and Australia for those people who have never been here or ever heard about it or never heard about it. So, Brisbane, basically located in Queensland state, is in the east coast. You can see we have beautiful coasts, beaches in the like Gold Coast, Sunshine Coast. So, in our Brisbane, this is the snapshot of Brisbane City. How it looks, we have beautiful Brisbane River. At the same time, very famous animals like koala and kangaroos, which can be accessed from. It's only 20 minutes drive from our uni, and it's great. The weather, you can see at the moment we are having winter, which is opposite to China and other countries. And also we have natural and man-made sort of coast environment. And this is South Bank, which is quite close to our university as well, like 10 minutes, and you can walk around and look at the city views. So within Brisbane, our university is called University of Queensland. Yeah, on the left here is our St. Lucia campus. And you can see our color is purple. It's mainly because the jacaranda is beautiful flower blooming in October, November. And also our Hurston campus, which on the background in here is the UQ Medical School. In this Hurston campus, we have our school of dentistry. This is our building, which was built in like only 6 or 7 years ago. It was awarded by Architecture Award, and in our school, we have been focusing on teaching next generation of dentists, and of course, we also do research, and also in our school, we collaborate with Metronorth, it's public hospital, and we work together as Oral Health Alliance, and we can access the patient resource in the same building, which is very handy for our clinical research. Other than that, within our school, I'm from Call 3 Center. Our Call 3 director, Professor Sasho Ivanovsky, is the head of school, and our research is mainly working on tissue engineering and also clinical research about diagnosis and prognosis. Within Call 3, we have different groups. I'm one of them. My interest is mainly about epigenetics, especially when they are diagnosis and also therapeutic as well. And we also have other colleagues in working on different aspects in our group. And you can follow our Twitter, yeah, X, but I still prefer Twitter, and also LinkedIn for our group and center page. Regarding myself, my small group is mainly working on two themes. One is salivary diagnosis, and another theme is extracellular vesicle as their cell-free therapy as regeneration tool. And over the past 5 years, our group has been working on different clinical studies. Have been publishing in GCP, Journal of Clinical Periodontology, and Journal of Periodontal Research, each of Dentistry Journal. So currently, I have been spending not very long ago. I only joined EV field around 5 or 6 years ago. So please, we all learning EVs together. And today I'm going to share partially of my research. Okay, now let's move on to real research. So first of all, what's periodontitis? Why we need to working on this disease? Periodontitis is basically a gum disease which affect your gum tissues. You can see here when you're healthy, you have beautiful gingiva and you have all your teeth in place. However, when you have gingivitis, when you brush your teeth, you might see bleeding. That shows a sign or early sign of the gingivitis. When some of the gingivitis patients are not treated, they can progress to periodontitis. When periodontitis happens, it's basically starting from your bacterial plaque accumulation. Basically, if you don't brush your teeth, don't floss twice a day, don't brush twice a day, floss once a day, sorry. Then those plaque accumulate under your gum, and then it can lead to your tissue damage, including soft and hard tissues. Then you will have a deep pocket, and then you will have a periodontitis. You lose your soft tissue of gingiva and periodontal ligament, and also lose your hard tissue of alveolar bone and cementum. But the worst scenario, you probably would think, oh, I lose my teeth. Why would I care? So you can see when a celebrity has full tooth, looks very handsome. If it doesn't have a tooth, it wouldn't look great. So that's why we need to care about our tooth. However, this picture I didn't do it myself. I didn't Photoshop. I got it from Google. So, and that's why we need to care about oral health and to try our best to keep our teeth in our oral cavity. So this disease, in general, is a chronic inflammatory disease. However, it can caused by bacterial infection and also can lead to the destruction of the periodontal tissue loss. Like I mentioned, soft tissue of gingiva and periodontal ligament (PDL), and hard tissue of alveolar bone and cementum loss. So once this happened, it will very hard to be regenerated by itself. And additionally, it linked to the systematic disease, such as heart disease and cancer and brain disease, and even osteoarthritis and other disease. That's why it's quite alarming that in some of the researches, especially when you investigate the systematic health, oral health is often neglected. So hopefully by end of today, you can feel that oral health is important. So currently in the field for this disease, we normally use a manual probe to detect any pocket depth, PPD, and any other clinical parameters loss. For the treatment, there are two types, non-surgical and surgical. So non-surgical treatment basically to using scaling and root planing to remove all of the bacteria, and then to retrieve your microenvironment from inflammatory to less inflammatory. And other than that, the surgical periodontal surgery also can be done to restore those tissues. However, current clinical treatment cannot successfully regenerate both soft and hard tissues in periodontium. That's why we both side diagnosis and therapy, we need more sort of approaches. And as I mentioned, periodontitis is relevant to a lot of other factors such as lifestyle, environment, and behavior. These all of the factors which will cause your epigenetic change. And genetic is one of the factor of periodontitis pathogenesis, but mainly it's about environmental factors. That's why where the epigenetics can kick in. And in our group, we have been in the periodontal diagnosis mainly. We have been working on demethylation, histone modification, and circular ions or macro ions. And all of this can be potentially used in saliva, especially can be used for diagnosis for the disease. At the same time, I would like to mention that the saliva also can be used for monitoring systematic health, especially in COVID period. We know that the aerosol and droplets transmission is one of the route for COVID spread. And following this, we did a study to use saliva and GCF to see whether your antibodies can be detected after your mRNA vaccine. So we found that it can be successfully detected in your GCF and saliva after you get Pfizer mRNA vaccine. And at the same time, we also did saliva HDAC, which is one of the histone modification enzymes. We realized that there are 3 or 4 HDAC markers can be potentially used as diagnosis tool. Other than the whole saliva, we also work on EVs. So in saliva, we all know that it's can be from both the host and microbial. But most of the research are focusing on human derived. So we commonly use CD9, CD81, those sort of marker to isolate human derived EVs. But bacteria derived EVs, especially from gram-negative bacteria, derived outer membrane vesicles are still lacking in the research field. So our group are currently working on how to isolate the bacteria-derived EV, which is very challenging. Hopefully, in a few years' time, we can report more in this space. So when I did my review in 2021, there were only 8 or 9 papers in the field to use saliva EVs and periodontitis diagnosis. Most people using different ultracentrifuge or precipitation chemical method to isolate EVs. Because precipitation methods, you can get the product from Thermo Fisher and some other companies. Ultracentrifuge is quite common still in the field, and our lab is using set exclusion chromatography (SEC) method to isolate EVs, and also except the saliva, GCF was one of the fluid under the gum. Is also has been used to diagnose. However, at that time was only one study was using GCF. By now, probably there was another 2 or 3 in the field. So I'm not very I'm not gonna talk too much because in the early years I was not targeting our dentistry journal, but currently I'm more targeting our dental journal. However, my initial results shows that global demethylation might be the key or one of the biomarkers to diagnose periodontitis. And following that, I did the deep sequencing to see whether any demethylome signature can be reflective of saliva and the disease. So what I did was I isolated macrovesicles from saliva, and we did isolate DNA, and we found that the single strand DNA was more enriched than the double strand DNA, which is quite similar to other people's research from plasma DNA. And we used a bigger sample size. We realized that with 5 MC, global demethylation was significantly high in periodontitis patients. And when we look into the sequencing data, we found more than 1,000 differential methylated regions, and most of the region were from, interestingly, is from coding domain, and some of them from promoters region as well. And I also followed up of those specific genes in the promoter genes region to see whether they can be used for disease follow-up. This data hasn't been published yet. It's in process. And so I know this is not relevant to the therapy, but I would like to share how our lab has done. So basically, I currently the EV, cellular EV can be potentially used, especially from EV medias, microRNA, or messenger RNA, or even protein or global methylation could be used. However, for anyone who are doing clinical study, we all know it's quite challenging to recruit agent and sex matched cohort, especially for the clinical trial. Currently, we are working on it to use bigger sample size to validate all of these results, especially for the panels we have found. That was the theme one I've been doing over the past 5 or 6 years. Now I'm going to move on to the therapy, which is the main focus of today's talk. However, I only entered the therapy space like 4 years ago. Again, it's currently in progress. So, in the periodontal therapy space, we did the review as a start. Everyone did that. You need to review this, all the literature to see any literature gap. So what we found is in periodontal or in dental stem cells, for example, dental pulp stem cells or periodontal ligament stem cells, osteoblasts, and also other gingiva derived MSCs, all of the research, around 30 or 40 studies have done using different dental stem cell derived EVs. And most of the EV isolation are using ultracentrifuge and also the precipitation methods and characterization, different study using different methods. But common ones are still using NTA, TM, and ELISA or FACS to characterize the EVs. And some of the studies have done sequencing, mostly are done in microRNAs, small RNA sequencing, and also found so many potential drivers which can potentially enhance the, for example, osteogenesis or androgenesis capability from these EVs. Now from our group, we have been using this. However, the main current study mainly only use one cell type. Our study was trying to compare between different periodontal cells, for example, periodontal ligament cells, osteoblasts, and gingiva fibroblasts, derived EVs, to see which one give the best or optimal regeneration outcome. So in our study, like I mentioned, it's only 3 years time, I believe. We have generated a few papers. We mainly use native EVs from the cells we never engineered, but in the future we'll probably engineer the EV. And then we use the EV loaded into nanopores, titanium nanopores, or using 3D bioprinting to deliver those EVs. So today I'm going to talk them one by one, but I will make it sort of efficient and hopefully people will understand. So first of all, we isolate the 3 EV subtypes from 3 different cell types. So PDL, osteoblast, and GF, those 3 cell types, and we isolate ectopic bodies, macrovesicles, and small EVs, and to give us a rough idea how many of the population and the proportion between these 3, we realized that the ectopic body mainly is about 60% of the whole EV population. Small EV are smaller yield, which is expected. We also realized one thing. We only use 2600 G to get ectopic bodies, and their size between these 3 subtypes are not huge difference. They are all around 200 or 120 to 150 nanometers, which is a little bit different for other reported. They can reach 500 nanometer size of macrovesicles, but I'm happy to discuss and for more further details. As standard, you need to characterize your EVs and using TEM, also we label them with DLO and also ELISA, and we also introduce a new technique using FTIR. So under FTIR, you can see different DNA, RNA, protein of their spectrum under FTIR. And also we use multiplex exosome kit to get the rough idea about the EV surface markers. This is a commercial product. We realized that in different cell lines and different subtype of EVs, CD9, CD36, and CD81 are totally different. Based on our experience, CD63 are the most enriched compared to another two common CD-EV markers. And after that, we traced the EV uptake from 4 hours to up to 7 days. You can tell that after 7 days, our EVs still stays in the cell very clearly next to the nucleus. And also, we compare the different subtypes of EV. We realized that small EV gives the best migration proliferation results compared to another subtype. And due to the limited EV yield, it was my first time doing EV in our group. So I only managed to reach our preliminary data about PCR osteogenesis or adipogenesis PCR markers, mRNA markers. Interestingly, we found that small EVs are more promoting osteogenesis, macrovesicles are more promoting adipogenesis to make the cell making fat. So our recipient cells are buccal fat pad derived MSCs, so it's one type of the mesenchymal stem cells. So following that was in vitro. Following that, we need to deliver those EVs in vivo. Again, this is a very early stage of the data. We are still in the progress of analyzing. So what we did was we use small EVs because we know they are promoting osteogenesis. We load these small EVs into hydrogel and then we place those into the periodontal defect, which mimic the human periodontitis defect. We realized that after 1 or 4 weeks, we can see some cementum formation and also very well functional aligned PDL. However, I need some more time to analyze the data. So that was first part. We compared the different subtypes of EV. After that, we utilize one type of the EV, which is macrovesicles, to see whether it can be loaded into some other nanoparticles or nanotubes. So in our group, I collaborate with my collaborator. We anodized the nano indental titanium implants and make the titanium oxide nanotubes, and then we load them macrovesicles into nanotubes, and then to see whether human keratinocyte epithelial cells would respond to those macrovesicles. Again, you need to characterize the EVs, and the size is around 130 nanometers. And also we have this classic EV surface marker. And after the SEM image, you see those EVs are quite big compared to the nanotubes, but they can be passively loaded on the surface of nanotubes. And under the microscope, we can see that they are on the surface of the titanium. And with time, we also see the EV release profile. It was highly released profile found in day 3 when we detect the protein. However, when we do the EV CD9 ELISA, we found 7-day has the most EV release. After we put the cells on the surface, we can see that with EVs, it can modulate the inflammatory cytokine differentiate expression in those groups compared to without EV loading. Again, following up on this, we did the in vivo studies in the rats. What we did, we extract the first molar and put the implants loaded with and without EVs into the first molar area. And after 4 weeks, we did macro CT and histology again in the process of analyzing the data. Hopefully, we can get some results by end of the year. That was the EV loading into the nanotubes. Another reason for optimizing delivery tool is we all know that EVs can be systematic delivered into your body by local injection or systematic injection into the blood. However, it can be cleared by macrophage within 30 minutes or even shorter. So for us, we want to promote the local tissue regeneration by locally deliver your EVs. So that's why we come up with the idea. We are not the first in the field, but we combine the bioprinting and the EVs. So what we do is we use GeoMa as in bio ink. We print the GeoMa with and without EVs. Two types of small EVs from gingival fibroblasts and periodontal ligaments. And then we use micro extrusion to get the scaffolds with and without EV. And also we put a buccal fat pad derived MSCs on top of the scaffold. It's not embedded into the bioprinting. We want to see whether bioprinting EV can be cell-free tissue engineering product. And then we explored the osteogenic and cementogenic and ligamental genic differentiation because in periodontal regeneration you need both soft and hard tissue regeneration. So we found that with and without EV doesn't really change the printability of the scaffold, which is a great thing to see. With EV, our scaffolds do get quite good printability. And again, EV characterization, using this time we introduced the cryo-EM into our characterization. We can see clearly the double layered EV structure. And after that, we need to make sure our EV can be released with time in vitro. So what we did was we captured the EVs on the scaffolds with time from day 0, 1, 3, 7. And then we calculate the surface, the area of EVs. And also we realized that the EV can be retained up to 7 days, about 80% can be released from the scaffold. And also we also did the degradation rate, and we found that up to 50% degradation up to after 2 weeks in 37 degrees. And also, mechanical property was not affected by adding EVs. That's what we expected. Regarding the cell attachment, we see the very low cell density onto those scaffolds. We can see that with EVs, cells can be spreading, and also the focal adhesion genes are significantly increased compared to the GelMA only group. And we also did the short term, about 3 days, and short term soft tissue and hard tissue regeneration here. We can see that the markers of the gene expression was significantly higher than the GelMA only group. Also, we did long-term differentiation after 2 weeks. Differentiation, we found that in the PDL derived small EV, you can see that significant ALP staining was found compared to GF derived EV. And also Ireland's red only did that the GelMA has a strong background, which is probably a common issue for everyone who's doing GelMA. But you can see that from the scaffold, the PDL derived EV scaffold can have higher alisin red or calcium formation. And also the soft tissue, we use toluene blue staining. We found more cells in those PDL and GF. So which means that PDL cell derived EV can potentially promote osteogenesis. GF, which is quite relevant to their own parental cell function. In our previous research, we found that PDL has superior osteogenesis capability in vitro and in vivo compared to GF. Again, when you did the in vitro, you need to validate those results in the in vivo. So we have compared the different EVs from different periodontal cells in the right skull defect, critical defect. Currently, The data analysis is in progress. That was about bioprinting EV and EV loaded into the nanotubes. These EVs are from from human cells. We also touched a little bit about saliva biofilm derived ONVs. So what we did is we collected healthy saliva from healthy patient, and we pulled them together, and we collected the media and then isolated we would say ONVs or bacteria-derived EVs. And also we tried the effect of those EVs on biofilm formation and also the oral epithelial cells on the titanium disc. Again, EV characterization, cryo-EM, FTI, and other NTA results. In our study, we used quite low concentration. We used 0.1 microgram, 1 microgram, 5 microgram. We found that there was not huge difference between those three concentration in terms of biofilm culture. That's why we use the lowest. We use 0.1 microgram. We found that after 24 hours or 1 day and 3 days of biofilm culture, the ONV group can significantly enhance the biofilm formation. And at the same time, we can see that the AMA blue or in the whole cells didn't show significant difference, but they can significantly enhance the L1 alpha cytokine differentiate expression in those ONV groups, which means this ONV, saliva biofilm derived ONV, can modulate biofilm community and the whole cell response. But we need to work on more on patient-derived ONVs because this study we use a healthy group, healthy patient. Okay, that's about me. So from today, take-home message for you will be when you do the collecting special healthy patients for your study as a control group, we strongly suggest you to consider periodontal health. As we can tell that the saliva EV can have significant difference between healthy and periodontitis patients. Another one will be how to isolate microbial-derived EVs, which is critical and difficult. And in the therapy part, periodontal cell-derived EVs, small EVs especially, can potentially promote your genesis, but more clinical or in vivo study needed. And also bioprinting and engineered titanium nanopoles potentially can be used as EV delivery tool, but we need more in vivo and clinical study to confirm. That's why in our future work, we probably will work more on in vivo and clinical trials, and also next step we'll work on the engineered EVs. For example, when you culture cells on 3D scaffolds to see whether those EVs can differ from 2D flask. At the same time, I'm open for PhD students if you're keen and if you feel our research fits your research interest, please contact me. And we both work on both diagnosis and therapy. As I mentioned, we use saliva diagnosis and also periodontal cell-derived EVs. But it's not only EV, our group also working on 3D bioprinting and using different scaffolds, polymer scaffolds, regenerating bone and other tissues. So at the end, I would like to acknowledge our core three for the support and my supervisor, Professor Sasho Ivanovsky in the middle here, and our students and my group members, all group members, and also the clinicians from our collaborator partners, Metronorth and BCPI, and also other collaborator from the uni and all in UQ. And last, I would like to acknowledge all of the grant funding, NHMRC and Osteology Foundation, ITI, Australian Dental Research Foundation, and also everything else. Thank you. That's it. I'm open
Thank
for
you.
questions.
All right, thank you very much, Dr. Han, for giving this excellent talk. Just now, Dr. Han actually introduced us the topics, very interesting topics on periodontal cells and the using the salivary derived EVs, not only for diagnostics but also as a uh, cell-free regenerative medicine for potential therapeutics. So I think some of the data and also the tools, the methodologies are of broad interest to our audience. So now let me also invite Dr. Zhang to join us in the discussion. I think there are a number of questions already. So Dr. Zhang, please. Uh, yeah.
Okay, yeah, thank you, Professor Xia, and also thank you, Dr. Han. It's very interesting talk because like my lab is also doing like a similar work. We also like use like stem cells and extracellular vesicles to regenerate like different dental tissues. Yeah. Actually, yeah, I think like this is like a very new area, and so I just like to ask some like general questions related to the application of EVs for like a dental tissue regeneration. Like first, I found like in a study you use like geoma materials to deliver EVs, and the EVs just can release very fast, just retained in the like periodontal tissue for 7 days. So I'm not sure, like, or do you think this is like enough for the, for the effects of EVs? And do you have like any other solutions to improve the retention of the EVs in a periodontal size?
Oh, thank you. That's a great question.
Yeah.
EV release always is the key for any of EV deliveries. So, in my opinion, I know you see that in vitro it's released up to 80% at 7 days or 14
Mm-hmm.
days.
Yeah.
However, in vivo environment is totally different. So,
Mm-hmm.
based on our current research, our gel mark can stay in the site at least for 2 or 3 months. For the EV release profile in vivo, I'm not 100% sure how long it will stay there, but the current
Mm-hmm.
research shows that when they deliver the EVA from other hydrogel,
Yeah.
they at least can stay for a month. And even we can't guarantee they will stay there for like 2 months. However, I believe the major role of EVs can be once they are released in the early time point, they can recruit more mesenchymal stem cells or PDL cells into the site.
Mm-hmm.
So which
Okay.
can yeah, mainly the environment itself can recruit more host cells to regenerate the tissues. But it will be very interesting to see how long the EVs can stay in the site. Ideally, it should be in the whole tissue regeneration process.
Okay. Okay. Yeah. Thank you. Yeah. Can I ask another question?
Of course.
Oh, okay. Yeah, yeah. Like, yeah, I want to ask, like, because like in this field, like many researchers use the EVs from like bone marrow stem cells or umbilical cord stem cells. So, what's the advantage of like the to use like EVs from like oral tissues compared to other tissues?
Oh, great question. That's the beauty of the dental tissues. It's
Uh-huh.
like it's a lot easier access compared to your bone marrow. For example, bone marrow. If you ask a donor to donate the bone marrow, is quite difficult and
Mm-hmm.
challenging. But for the tooth, for the dental tissues, most of us will need to get our third molar extracted, which is wisdom teeth. So those are the best source for our dental cells, and
Mm-hmm.
especially PDL and dental pulse stem cells. And especially, for example, let's say in a very long term or big picture, you want to extract your third molar and you book your appointment, get your teeth out, and then you can do a tooth bank. Basically, bank all of your tooth, dental tissues and cell tissue you can't, but you bank your cells. In the future, you need the isolate EVs. I see dental tissues are quite handy and easy to access compared
Mm-hmm.
to other tissues. That's a great advantage of the dental tissues.
Okay. Yeah. Thank you. Thank you. Thank you very much.
No worries.
So I'll also join in asking some questions on where. So so I would be I wonder if there are some questions from the audience. All right. So otherwise I'll ask. So Dr. Han, um, for the titanium implant, you actually put EVs, right? And you
Yeah.
profile the release of EVs up to 7 days. So, do you have data like for the EVs to be released from these implants, like for a longer period of time? So, what's like the maximum? So, your data show that 7 day is the maximum release, right? Uh, so
Mm.
so so how much you put, how much EV you put, and how much will be released in the time dependent manner, and what is the optimal condition for delivery as a whole? So this is my first question. Mm,
Okay, yeah, thanks. Well, in our study, we use 10 to the ninth particles, EV particles,
mm,
for each small titanium. So we're
mm,
using titanium wares. It's
mm,
around 1 millimeter in diameter. It's quite small. It's not human equivalent, smaller version.
mm,
and and also it's only passive loading. We
mm,
can't guarantee how much EV was loaded onto the scaffold onto the titanium wares. That's why we just use the microscope to see how much it has been done. But I do agree with you. We need to extend the time, especially for months, I believe, or even years, because
mm,
titanium implant will stay in human body for forever, hopefully.
mm, mm,
So,
mm,
but our study was mainly in vitro proof of concept. We all know that epithelial cells will attach to the titanium implants in a very early stage, probably a few
yeah,
days.
mm,
That's why we only did the early stage. However, if
mm,
we want to look into the osteogenesis, for example, we definitely need to extend the time at least for 2 or 3 weeks to see how EV were released, the profile.
mm.
And
So,
also,
mm,
either for the EV in vivo, personally, I think it's quite challenging because when you put the implants into the jaw or mandible, it's
yeah,
quite hard to make sure EV or nanotubes are still there.
Mm.
From my opinion, we can't say it 100% okay, my EV or nanotubes are still there after I screwed into the defect. That's a challenging for every dental implants or any implants.
mhm.
And yeah, we're still working on it to figure out how the EV perform in terms of delivery by the nanotubes.
Yeah, so in that regard, I think because so this is a one shot. So if you need to repeat it with administration, right? How can you realize, like, or overcome those challenges as you mentioned? So I think there are like, yeah, some obstacles to overcome in your future research and also for the field. Mhm,
Yeah, and also it's extremely challenging, I believe,
mhm,
especially for the dental implants.
mhm,
However, there's one good thing about our study is we are focusing on soft tissue regeneration for the titanium nanopores.
mhm,
So hope, we
mhm,
assume we didn't screw the whole implant into the bone, so we leave
mhm,
about 30%. We hope our nanotubes and EVs are still there. Regarding one shot or multi injections,
mhm,
my personal thought would be once for all will be better because
mhm,
once you do multi injection, the local injection disadvantage will show up again because when you do the local injection into the site, you don't really know whether EV would stay. You probably go to your bloodstream or go to the next tooth
mhm, mhm.
neighbors or some other tissues. So, for my own perspective, we believe that delivery using nanopoles or bioprinting hydrogel or injectable hydrogel, things like that, it can make sure the EV are released locally, mainly for the tissue regeneration. Thanks.
Um, so another question is regarding the EV isolation from the salivary. So we know like all the body fluids contain EVs. Is there
Yeah.
any difference? You mentioned some of the procedures, but not in that much detail. So can you compare like EV isolation from salivary or compare with other like body fluids? So any specific precautions that should be taken care of if more people are interested in doing research in this field. So what is your suggestion, advice?
A great question. That's for the biofilm fluid. Yes, there are a lot of precautions. Um, from my own experience, I haven't touched plasma yet, but it's on my radar to compare saliva and plasma from the same patient. From our research, we have compared the saliva and the gingival fluid, we call GCF, and the isolation method basically is the same. But there's any difference for saliva is quite highly viscous. You need to
Yes.
dilute it with PBS 1:1, but GCF is quite it's like a serum, and you don't really need to, but you just need to add PBS in there. So that's the sample themselves, and also for the GCF or saliva or plasma collection has its own sort of conditions, fasting or not. But for saliva, you need to make sure the patients are not drinking and eating for at least 1 hour, and your collection method is either spitting method like passive drawing or stimulated saliva collection. Everything can change all the EV composition and everything else. So from my experience, we're using spitting method and stimulated saliva. And in the saliva itself, after you collect saliva, you also need to consider whether you centrifuge or not, because for us, we use whole saliva. But many researchers using 2000 G to centrifuge get the cell-free supernatant only. But from our perspective, we feel whole saliva can mirror the health more accurately. And that's a sample collection themselves. Other than that, the patients, that's a very basic requirement for all of the clinical studies. You need to make sure healthy patients are healthy. So in our field, we need to make sure the patient bleeding or probing is one of the, I'm sure Professor Zhang would know what I'm talking about. So BOP has to be less than 10%. That's the newest guideline. Again, you need to follow the latest guideline, not 1999 guidelines, because all the clinical parameters varies. Same thing for other field. So definitely need to follow the latest guideline of the clinical diagnosis. That's the starting point. I'm happy to share more based on my experience, but I'm not expert in blood and other biofluid.
Thank you very much, Dr. Han. So I wonder if Dr. Zhang has other questions. Or questions from
Audience?
audience? Yes. Let me check. So, and otherwise, I will also I have a question for both of you. So, Dr. Han is an expert for the dental health in Australia, and Dr. Zhang has experience in Netherlands, also in Shenzhen. I know in developed countries like dental health is very much valued, and people have a very I can kind of like higher level of awareness for dental health. Now in China, I think it's improving. So I don't know if there's any data for comparison. Of course, our topic today is EV, but it's related to dental health. So my question is, if you have any data regarding the comparison of like Chinese population regarding the dental health versus those in the developed countries. And second question is if you have any advice for improving dental health. As an expert, I think in doing research, even you are not a dentist, I assume, right? But you have very close interaction on research in the field. So two questions, comparison and also advice.
Okay, cool. I might start with Australian population first. In Australia, well, our data is quite old actually. It's 2019 it was published. latest one was 2021, I believe. Or anyway, in Australian adults population, probably around 30% of population are affected by gingivitis. No, sorry, periodontitis, which is severe version of the gum disease. For indigenous local Australian indigenous population, it's even higher. It's more than 50%. And for the severe periodontitis in Australia, especially for those people who are aged over 70 years old, it's more than 60% affected. So it's quite severe. However, because of the oral health and it's not included in the Medicare in Australian medical system, not everyone wants to see the dentist. You're supposed to visit. Yeah, you need to visit dentist every 6 months, but it's quite expensive. Few $100s involved for each visit. That's one of the main reasons oral health are quite alarming. Yeah.
Yeah, okay. Yeah, I will talk something about like the situation in the Netherlands. Actually, as far as I know, like actually like the subject related to like public health. Actually, I think it's also not that valued in China like, before the epidemic. I know, but in Hong Kong and many researchers are doing some work related to like public health, also like related to oral health. So I think now like in China, more and more people recognize like the importance like of like the teeth or the oral health. And the reason why I think like Dutch people cares more on that. Actually, I talked with my Dutch colleagues. They said that because like when you smile and people can directly see your the teeth, so that's really like affect the impression of like other people. But I think like in China, yeah, it's not that important in our daily life. But I think as like Professor Xia said, like the situation is like is gradually improving. So I don't have the specific data about like the public health about like the comparison between Netherlands and China. But I think like because I'm doing research, so I just know the trend of the funding support between Netherlands and China. So in Netherlands, I think like you can easily get a funding like from like the dental area, such as for example when we drink like Coca-Cola and we want to know how like the Coca-Cola affect like the conditions of your teeth. Even for that project, you can get a funding from Netherlands. But I think like in China, we like to focus more on like fundamental research or some like drugs or some treatments which can really cure the disease. Yeah, that's also like something like
But that's also
in Netherlands
important,
and
right?
China.
For those like in a really applied field. So these actually relate to our daily life, like Coca-Cola, drink Coke, right? So it's actually so of course like I think we still need time to change our mindset, right? Of those kind of
Yeah,
research
yeah.
is also important.
Yeah, I agree. Yeah, yeah.
Yeah. So sorry, please.
Yeah, no problem. And also like from the view of like insurance, I think in China like actually most like dental diseases are not covered by the insurance. But in Netherlands, you have to buy like a special insurance. It's different from like the public like disease. Like
Medical insurance, right?
yeah, medical insurance. Yeah, then like it can be covered by the insurance. So that's also can encourage people to go to the hospital to check their health,
Yeah.
the oral teeth conditions. Yeah.
During the Qingming Festival, I got back to Hangzhou, my hometown, and I found that there's a network of dental clinic. It's a hospital. It's called Hangzhou People's Hospital for Dental Health. I just translated it. It's a very big dental clinic, and it's so I got there because my dad needs to have some like a new tooth, like his teeth has some problems, so I accompanied him, and also I got my teeth like washed, 洗牙. So I enjoyed that service. It's very professional. So and also the prices I think is reasonable. It's accessible by the general public. So I think those kind of like dental clinic or networks will help. And of course, like in the public hospitals, they also have those dental department, right? Uh, so this is my kind of like a personal experience. So I think there are changes in the area. And so, but of course, I think the statistics, as mentioned by Dr. Hans, like in Australia, I think in China, those numbers could be even higher, or right for the proportions of people with those conditions. So of course, like dental health, right? We need to brush our teeth, like use the dental floss or whatever, right? So we need to like brush our teeth before like sleep, all those kind of general steps. But some people even like brush their teeth like 3 times a day. Uh, but another factor is aging, right? When we age, when we get older, so those kind of conditions are inevitably will deteriorate the conditions, right? So like the gums will withdraw, all those conditions.
Recession.
So yeah, recession. But of course, we do see people at a higher age, like senior citizens, right, with very good care of their teeth. They also have very excellent conditions. And so, any easy or simple advice like to prolong our dental health, to slow down this kind of like aging process.
Um, Aging, probably we can't stop that.
Slow, only slow, yeah.
But yeah, one of the factor you can slow aging will be changing lifestyles, eating healthy diet. It's relevant to oral health and the systematic health. And
Yes.
for the oral health, is like you said, and very easy. Floss once a day and brush twice a day. That's minimal of oral hygiene. And that sounds easy, but sometimes it's hard, and especially the awareness in the community, general community, is not uh, it's not how to say, not everyone knows that it's so easy to stop severe disease or lose your tooth. But
Mm.
again, dental implants are quite advanced. You also always can get um,
Yeah.
implants done, and yeah. So that's why maybe that's one of the reason people didn't really want to work on the prevention. They say, "Oh, I just change to add one implant." But again, the key message is still like floss once a day and brush twice a day. Uh, to start with, it's very easy. Yeah, and
Thank you.
see your doctor every 6 months. That's at least Australian
Yeah.
dental association recommend that.
Mm, mm. Yeah. So, so I think we have, if we don't have any further questions from the audience, and I think have very good discussions, not only on EV research and applications from Dr. Han's group's research, but also we discuss some advice or as a good practice, like to maintain our oral health. So, so with that, I think I'd like to conclude today's seminar sessions. And let's join hands and also thank Dr. Han for giving us this excellent talk, and also Dr. Zhang for helping with this discussion, the Q&A sessions. And I hope that this talk and also discussions will be of use and helpful to our audience. And also, I'd like to introduce again our journal, Extracellular Vesicles and Circulating Nucleic Acid. It will be it's already indexed by ESAI, and I think it's a growing platform for communicating for the community regarding the research on EV and also nucleic acid, and not only the basic research, but also I think for applications using EV as a tool. So with that, thank our speakers and also Dr. Zhang, and thank you for with us having this session with us, the audience. Thank you very much.
Thank
you.
you. Thank you for the invitation.
Mhm.
Okay.
Okay,
See
bye-bye.
you.
Bye bye.
Bye.
结束了。嗯，结束吧，你这结束完了吗？完了。都走了，他们还没有说，他们还不知道吗？你没听吗？
你们今天我完全没有记录，我觉得你们弄的挺好的。
一点都不好。我跟你说，做英文汇报根本就没有人提问题，因为大家可能好多人听不懂。
听不懂是吧？
对。
哦。
所以以后如果做英文汇报的话，我们应该把我们的庆编拉进来。
对，这样问了几个？
2个。
这样他有点废。没有，我的意思是，就是整个流程啊什么的，也没有啥问题，是吧？
没有，
这个还可以。
就是夏老师最后2分钟进来，给我搞紧张了，因为他那个直播的也在那搞直播嘛。然后，
这个没问题。然后我现在给你们再说一下，就是我们你看夏老师那个白的背景也不太好看，就我跟你说的，需要做一个那个，然后要求今天给那个谁提过去，然后那6月21号那个就给李老师说，我们看了一下那个做双语的话，怎么说呢？
效果不太好。
效果不太好，然后让他用那个中文，对，然后就是我们国内的这个平台上面可能还是国内的老师比较多，然后我们后续有国际，我们国际的研讨会目前也在策划的过程中，后期的话就是国际的研讨会我们有的话我们也会再继续邀请他，然后来做国际在这一块儿，但是他其实我感觉他也是想往国内的，这是第一个事情，然后现在接下来你要在群里面赶快发个那个啥，你把这个洋洋也邀进去。然后在群里面就发一下，感谢一下那个夏老师今天的一个，感谢人家夏老师的一个那个精彩的一个主持，然后也感谢韩老师，然后那个最后再感谢那个张老师，然后积极参与讨论。对，张老师他有点拉垮，
他们2个问题。
他作为讨论嘉宾弄2个问题以后，就这种事情就不再。
韩老师问我关注咋没人问问题呢？
你跟他说，你说我们你说我们国内的大环境，大家普遍英语还不是特别好，就是我上次中文的时候，大家问题问的特别多，给大家这样说一下，就现在群里赶快把人家感谢一下，感谢完了之后就联系那个夏老师，然后确定饶浪的那个时间，确定完了之后联系那个林勇老师。然后那个啥，完了今天把那个回放发了之后，接下来就赶快推李勇老师那个，推的时间久一点，把那个怎么说呢，人弄大一点。而且我跟你说一下，就是我今天没有把全程去那个，我觉得你们协调还不错。后面的话，国内这一块的这个会我就交给你来做了，我可能就不再参与到人啊什么的。可能这一段时间我可能还会给你再挖一些资源，但是后期的话，我这儿又接了一个看。
又接了一个看。
对
，2个看。
对。所以后期的话就是，但是这2个看都是非常重要的，我都会评分好，一个因为现在一个 MRR。
作为生物的。
对，你不是做视频的吗？那个我那边还有一个做视频的。
我知道那个。
对。
上次做主持的那个，我知道那个是也是我们学校的， 然后还是另外
徐一
一个
帆是吧？
另外一个课题组老师的。
哦，那还挺好，那你们这个，我觉得也还挺好的。
然后说，好家伙，这陈同学都是我同学。
那还挺好的。然后后面的话就是，但是就是咱们这看很重要，是在发展的关键时期，那个看也很重要。所以的话，就是我会尽量做好平衡。然后国内这一块的话，会的话，我现在已经上一次我也没参与，这一次我也比上一次参与的更少，所以我觉得你这一块做的挺好的，你就按那个做吧。然后就是每一次肯定都有一些小的瑕疵，那个咱们不断改善就行。然后咱们不断改善就行。
然后我完了以后，我把会议准备的那些东西啊、流程啊，
对，
就是叫问的那些人员啊，总结一个 Word 吧，
对，
放在咱们群里面。
对，可以弄在群里面。然后你完了把洋洋也拉进咱们那个群里面来，就是废书群，然后还有咱们的那个小的微信群。对，这会儿你赶快在
是要感谢
群里面发感谢人家夏老师那些。行，你们先。
好，你先拉一下我啊。国内的大环境，但是英文普遍听不懂，不是说没人问问题。你进群了吗？我说这个感谢应该咋说？想想。这样说，非常感谢韩老师的精彩汇报，感谢夏老师的出色主持，以及张老师作为讨论嘉宾。
这是先感谢韩老师还是先感谢夏老师？
先感谢韩老师呀，因为人家做的报告嘛。先感谢夏老师，还是先感谢陈老师？
好像我听刚先感谢夏，然后再感谢韩，再感谢郑。
行的嘛。老师刚说的先感谢夏老师是吧？
对。
我都已经说完了。
你出来了，你把您表还给我发一下。
然后你也发一下感谢。
嗯。
我拉的圈，你看见圈
我
没？
看见全了，我看你怎么发的。
你就写个，
我看一下啊。
我
看他们主要是干嘛？
然后你写感谢各位老师的，你就写感谢各位老师的啥呀？
感谢夏老师。哎呦，不好意思。
你不用
韩老师，不是陈老师。
不是，我都发了，你那个啥。等会儿。别打，这个是我参考的别的那个群消息。这个是我发的消息，我都发了。然后你就接着在群里说，感谢各位老师的，你就写个感谢夏老师和韩老师的精彩主持和报告。然后感谢张老师的积极互动。
韩老师是 HAN 还是韩
？HAN。写的一次以后，因为中文的话知道是什么字，但是一直没有用过。
一个两字。 这昵称就是自己的名字，是不是？
嗯，
好的。
那再接了一个看，没事，那个看它里面还有机器人。也不错了，也不错了，1万多人了。
1万多人，还可以。
走会。
充电器没有充电器呢，那我这电脑给还了吧。
让我想想还吧，以后不做 YouTube 的直播了。又没人。
给，这你的。
以后不做 YouTube 的直播了，烦死了，浪费我们的时间。
那我就还这个。我这登的这些东西。
你在那个飞书上，然后那个公费资产里面，你点击那个资产退还就好了。关掉，以后不做那个 YouTube 的直播，不做。你公费资产，
公费资产，查看详情。
看一下。